Welcome back. I'm Dr. Lisa Erickson, and today we're going to discuss low back anatomy and joint pain that we see in many athletes. Just talking a little bit about anatomy, here is a model with two vertebrae, and to teach you a little bit about this anatomy, here is a view from the side. We have our big, beautiful vertebrae, one stacked on top of each other with a nice disc in the middle. Between the two vertebrae is a hole where our nerve comes out, and in this model what we see is a little red spot, and what that little red spot is a disc bulge, and that's just on the model. At a young age, our discs are very soft and squishy, more like jello than anything else. So if you spend a lot of time doing right side bends while climbing or leaning your desk to the right, you can get a bulge on the left-hand side, and that is what this model is showing. These are more rare in my office. I see more muscle issues and more facet joint issues, but this is something worth discussing. Looking at the back of the model, these little pokey guys that stick out from the side are called our transverse processes. So here's a view from the front, transverse processes on either side, and then flipping around to the back, here is a view of the spinal cord right down the center, and then this is called our spinous process. It's a little bump that sticks out on the back. So you'll feel your little knobs down the center of the spine. Those are our spinous processes. And then viewing from the back, here are our transverse processes, left and right. Most people believe there's only one joint between the vertebrae. It's called the disc. As we start to learn, we start to see many more injuries in our facet joints. And here are our facet joints, these little tiny things right here on either side. They connect the vertebrae on the top to the vertebrae on the bottom. And if I were to bring this up closer so you can actually see what we're looking at, we can actually take these joints and gap them and close them. So here is one facet joint, and it is where one vertebrae on the top meets the vertebrae on the bottom. We also call these zygapophyseal joints, and they are on both sides and between each vertebrae the whole way up our spine. This particular vertebral model is of the thoracic spine, so these joints here are designed for flexion and extension, opening and closing those joints, and they have a little plastic bag around them that's called the joint capsule. If you bend too far forward, you can strain that joint capsule if it's not used to the motion, or if we do too excessive of a back bend, or say we lay on our foam roller and we jam those joints, these joints can close down and compress right through the center right here, and what that can be is a inflamed, unhappy facet joint. So if you feel more pain on one side than the other, it could very well be all the overlying muscle on top of these joints. However, if you upset one of these joints and you make them inflamed and stiff and unhappy, they will also recruit spasm in the muscles of the erectors that go right along the spine. And then there are also muscles that connect the parts of the spine. So there are muscles that connect this transverse process to the spinous process below it. There are muscles that connect the transversus process to the one below it on the same side. And then there are all these muscles that come in and attach onto these. So for the low back particularly, we have muscles from the pelvis that come up and attach in here, our quadratus lumborum muscle. We have our ab muscles that wrap around the back and also attach into these structures. And then we also have our psoas muscle, which is our deep hip flexor on the front of the spine, that comes right through and attaches onto these guys from the front. So there are a lot of different muscles at play that can either bind these joints or tighten up while these joints are unhappy. A little bit about the symptoms you might have, because everyone's worried about disc pain. If you do indeed have a bulge where this disc is, this bulge will give us symptoms related to this nerve. This nerve carries pain fibers. 10% of the nerve is pain fibers, so if you compress 90% of it, but you don't compress a pain fiber, you won't have any pain. And the symptoms of that would be numbness or tingling down the leg in very specific patterns. So if this was your very bottom disc in the very bottom of your spine, what we would notice with that is we would have numbness in the foot, the inability to push off or pull up the toe or wiggle the big toe, and that is usually not associated with low back pain. And my younger climbers, when this disc bulges, we tend to have quite a bit of low back pain and shooting pain, but if it starts to be associated with numbness, then we're going to start really looking at these discs. With that said, when you piss off one of these little facet joints, what that's going to do is be highly painful with forward bending, with back extension, and oftentimes when these little joints are unhappy, you get this handprint of pain in a very large area down into your glute muscle, into your hip, into your low back. So that could be very much a facet joint pattern that we see with injuring these joints. Most of my patients that bend too much weight while standing up or are doing lots of twisting and bending with loading, that is more of a sign of irritating the disc, because the disc actually, on the outside of the disc, we have something that looks a lot like a chain link fence, and it is composed of these fibers that are cross-linked. And so when we do lots of twisting and bending with heavy loads, we will actually tear those little cross links. And so that is something to keep in mind while we are climbing, since we're doing bending and twisting with that. Keeping the core engaged really supports this disc, but we don't have to worry about this too much with a disc problem with climbing unless we have an impact on the back or something is already going on in there that we need to keep in mind. With my younger climbers who are in high school and college, especially females, we have to watch out for what we call spondylolistheses, or one vertebrae shifting forward on the other. And that happens if we have a fracture back in here through this piece of bone. Let's zoom in, this right here, that is called the pars. And so if we fracture through that, which we do see in some types of athletes, female are more prone to this issue, as are certain genetics. So Alaska Natives are more prone to it. Basic American Indian type natives are more prone to it. So if you do have low back pain and you are a younger high school athlete, I would highly recommend going to your doc and having an x-ray just to make sure. But when we get a stress fracture through there, this vertebrae on top can actually start shifting forward on the vertebrae below it. And we may have fractures on both sides, or it may just be one side. But that's something to keep in mind with the younger athletes. We just want to rule out things that's not, and most patients do not need x-rays, but if this guy is a failure to resolve, if it's just not healing with traditional care, then we need to go back and do some x-rays and see what exactly is going on. And in cases that have numbness and tingling in the legs, then we do an MRI just to make sure that we know exactly what's going on and we're working in your best benefit. So that is a quick little tour of the spine. And then last but not least, before I forget, I know we were talking about this little space between the two vertebrae. This little canal can actually be quite small, the space where the nerves come out. Some people have just less space than others where that nerve comes out, so they're more prone to numbness and tingling, especially like in the hands. And those patients, we call them facet stenosis, or there's just less of a space where this nerve comes out. And for those guys, our biggest goal is keeping muscle tone under control, because just because you're having pain and shooting symptoms doesn't mean it's actually coming from the bones and the nerves. It could very well just be a mechanical compression, like your muscles are so tight that they are compressing the nerves. So almost always we go after the muscles first. We get those nice and soft and loose and supple, either with self-care, with a tennis ball, with a foam roller, say in your hips. And then if that doesn't come around, then we start doing advanced imaging and seeing what's going on and really start rehabbing things up with strengthening. So thank you so much for checking in. If you have questions, I do online coaching. It's $25 a week after our initial visit. And my email is climbinginjuriessolved@gmail.com if you're interested in connecting with me. And I thank you so much for watching my videos. I hope you share all my info with your friends, and the goal is to educate you and inform you so you're not scared making your healthcare decisions, because very, very rarely are these things surgical or needing advanced supervision. And a lot of times we can untangle things, change your mechanics, change how you sit at work, and all of a sudden these problems heal. So don't be afraid with working on these things. It's much like working on your car and the whole doom and gloom scenario often that medicine tries to portray onto you guys is something that I'm just not a big fan of. So thank you for checking in, and have a lovely day.